I think there's so much learning that we've got from different areas of the community, especially around here in the east, around the North Bournemouth area. The messaging that we've been putting out as a service, we've been kind of promoting the vaccine, we have been sort of giving information to the public, almost the information that we feel that people need. But talking to people in the communities, we've been able to sort of understand a bit more why they're being hesitant.
I think it's about reaching out to communities that are perhaps a bit harder to reach for a variety of reasons, building bridges with them. Invariably these communities struggle to access our clinics, whether it's because of transport or because of disinformation or because just, where life took them and they feel like they can't access health services. So it's about creating those bridges, building a relationship of trust to eventually perhaps bring them into our services in time. My experience, we've done a few pop-up clinics in places like Swanage, where people were really grateful for our presence there because they're elderly, they may struggle to get on public transport. Doing the clinics with familiar local faces as well is really important because people trust, is again about trust, they trust those people and they will come to us because they see that familiar face. And the same with the outreach clinics, it's going to the population that for one reason or another struggle to come to us, whether it's because of transport or because of just an awareness of what's on offer. Just being inclusive, so anything we can think of that will include more population, so yeah, different languages, having health checks. So we want to work with MEC, so making every contact count. With vaccinating, we actually have a population that we see is like from young children to the very elderly, so we've got an opportunity there to do health checks, to promote other services within healthcare in that contact. It may be the only time in the year that they see a health professional, so we're very keen to expand on what we do to make every contact count.
So we know that the vaccinations are behind clean water is the second most effective public health intervention that we can make. So it's essential that we do go out to places where people can access vaccines a little bit easier. We've done lots of work with homeless communities across various programmes. So some where homeless communities have come to our sites across Dorset HealthCare, particularly in Weymouth, and had an opportunity to get vaccinated on a quieter day. We've also gone out to many lunches and kind of community meetings to not just provide vaccinations, but also that wider health and wellbeing support. So we've linked up really well, I think, with mental health services, local charities, particularly the Health Bus over in Bournemouth, Christchurch and Poole. Again, mentioned earlier, some of our most vulnerable people in local areas, to give them that opportunity to get vaccinated and all of that wider healthcare and wellbeing support that they really need. They've been so welcoming, letting us come and use their spaces, their volunteers who are just fantastic, all their links into the community, publicising in areas and channels that they know works for them. I think we try to communicate in a really wide-reaching way. Some of them all local targeted initiatives have really supported that. They're fantastic people who we're very, very proud to work with. As I say, without them we wouldn't have the successes that we've had. And I think when you get them all together, they're so dedicated and want to support the people they care a lot about. We've partnered up with a local food bank to bring a food bank collection box up to our Kings Park vaccination centre. One of our aspirations would be in the future that people can come to get vaccinated, and if they're able to and want to, can bring something to put into the box. I think we've just started to scratch the surface really with what we could do. That wouldn't be possible without the support. I mentioned the partners being fantastic and that engagement. Also wouldn't be possible without the support of the whole service, integrated vaccination service, at all levels, at all roles, across all sites. They've been so supportive in championing us to have that confidence to try new things. Also for our staff as well, really recognising that they're a key part of their local community too, really key part of that wider holistic kind of approach to health and well-being, which I think we're really fortunate to have here in the vaccination service, because as I said earlier, we do touch and reach so many different communities.
Part of my role was obviously building relationships in the community, which would enable a long-term kind of continuity in the community. And I think for a lot of the Health and Inequalities programme, there has to be that consistency in maintaining those relationships. You have to build that trust, because once you build the trust in the community, we're able to roll out things a bit more effectively, and people are more upcoming and can come forth and are happy to access our services. So I think long term I would like to see that relationship nurtured and grown to another level, so that it's not only about vaccines, it's about other services that we bring out. These communities are more than happy to be able to come forth and take part.